and there are many different strategies. One would be that we can start with patients who were not treated with covalent BTKi, because what we have shown is that if a patient had C481 mutation, they are highly likely having progression with pirtobrutinib. So if we start with the population that doesn't have the C481 mutation, that means they haven't been treated with covalent BTKi, then I feel that we will have better responses for those patients. The other strategies, of course, are combination, and I will be talking about that. One is the sequencing, pirtobrutinib followed by other agents such as even covalent BTKi and venetoclax. And when the disease progresses, we are showing that C481S clone is eliminated. So again, these cells are resensitized to covalent BTKi, which is really interesting. So we can come back with covalent BTKi for their therapies.